So I'm looking to see that there is return to color less than 3 seconds. If it took longer than 3 seconds, then it would indicate poor oxygenation, as well as if there was carbon present. Which everything is fine and checks out. So we can go ahead and put your socks back on. Okay, and after that,
and it is a grade 2. You want to go ahead and take your shoes and socks off for me? I'll get those other pulses. And you can just leave them off because I'll have to assess your feet later. Okay, pulses here. We're going to start with your dorsalis pedis. And it is a grade 2 in your posterior tibial. It's also a grade 2. So we have all your pulses assessed, your vital signs. Now we're going to move on to your skin. Just going to pull your shirt up quick here. Skin is warm, dry, intact. I don't notice any lesions.
Shot. And I'm going to just push your feet up and so have you had any change in smell lately?
No.
Okay, so cranial nerve 1 is intact, and then for cranial nerve 2, I'd have you use the Snellen chart, but it's not here, so I'll just describe it. Stand 20 feet away with your contacts in or glasses on. Cover one eye, read at the lowest sign possible. Cover the other eye, read at the lowest sign possible. Both eyes open, read at the lowest sign possible. And then if it was anything more than 20/30, I would refer you to an ophthalmologist. And then I'd also do the near vision test. So I'd have you hold something 14 inches front, 14 inches away from your face, and have you read it. And then you would pass if you didn't have to move it closer or further away. And then your visual, it would be expected that your visual acuity would be intact when those two tests. So cranial nerve 2 would be intact. So cranial nerve 3, where did my pen light go? 3, 4, and 6. And then measure your pupils.
less than 3 seconds. And then we're also going to assess her capillary refill on her toes as well. Okay, those in less than 3 seconds. Okay, good. Okay, after that test, I'm going to take your socks off for this one more time. Okay, and I'm just using the back of the mallet. I'm going to make a straight line going across the bottom of her foot. Here we go. And here we go. Okay, so
Turn that back. Good, okay. I'm just going to go ahead and check your pulses. Okay, and I'm just going to go ahead and check your capillary refill down here as well. Okay. And I think that's it for me, and we're going to have another nurse come in and do more of a focus assessment.
Hi there, Lexi. Yes, hello. My name's Caroline. I'm going to be doing you.
Do you care if I take your shoes off? You can go ahead. That was kind of gross.
Oh, they're really tight. You're gonna have to pull. All right, and I'm gonna wash my hands real quick. Touch those shoes. So next I'm going to take my pencil and I'm gonna move it up your foot. Are you ticklish? Mm-hmm. Okay. And just point your toes a little bit up. Yeah. Thank you. Okay. Alright, so we had a negative Babinski, which is what we're looking for. Okay, we're going to move on to the cranial nerves. So Have you had any changes in smell recently? No. Okay, since there is no changes in smell, cranial nerve 1 is intact. Cranial nerve 2 would be intact if I have my smell chart in here and my patient like covered one eye, stood 20 feet away, covered one eye, read to the lowest line possible, cover the other eye, read to the lowest line possible, uncover both eyes, read to the lowest line possible. You're allowed to wear your glasses and contacts during this, and if we would expect your vision to be 20/20, and if it was 20/30 or worse, we would refer you to an ophthalmologist. I would also have you read a card that has 14-inch font on it, 14 inches away, and if you were able to read it without accommodating, then you would you would
pass those tests.
and so your cranial nerve 2 would be intact. Cranial nerve 3, 4, and 6, I'm going to do right now, so I'm going to measure your pupils real quick. Alright, so 4 millimeters in size.
They're round, they're equal.
So next I'm going to shine a light in your eye, so just stay looking at me. I'm going to shine in your eye twice, okay? In each eye, twice.
Have you take your shoes off? We can go ahead and do that. So you take your shoes off for me. Perfect. So to the side. All right, and I'll have you lay down or not. So you just stay. Okay. What? It's gonna tickle. Oh, okay, good. So like this. Oh, it didn't really work. Okay. No. Okay. Well, it would work in the real thing, and her toes would flex downwards, meaning that she has negative Babinski. That's our expected finding. If her toes flared up and fanned, that would be a positive Babinski, and that is not good. So next I'll be testing your, what is it? Oh, your sensory response. So if you could close your eyes for me, and I will be using my pencil for this, and if you could just tell me when you feel sharp or dull, stimuli. So.
Extend, flex, extend, rotate. Okay, now with resistance, extend, flex, extend, flex. Good. Other leg. Extend, flex, extend, flex, rotate. Okay. Now with resistance, extend, flex, extend, flex. Good. And I'm gonna have you flex, and we're gonna do Holman sign. Do you have pain here?
No.
Okay. And then here, flex. Do you have pain here? Okay. Now I'm gonna be looking at your toenails. Good hygiene. No evidence of any lesions. Okay, capillary refill is less than 3 seconds. Good. Alright. There's no evidence of edema. The skin is warm and dry to touch. There's no evidence of any blood clots or any claudication. I'm gonna have you now sit on the bed.
Good. I'm going to check capillary refill. Toes. Good. Let's check the other one. Good. Alright, we're going to check your muscle mass. So if you'll just
Okay, looking at my patient, can you have, thank you. Posterior tibialis. And dorsalis pedis. Also checking for cap refill again. This is less than 3 seconds. I'm going to test for her Babinski's reflex. I'm sorry, this might be a little uncomfortable.
Okay. It's a normal finding for an adult. Okay. Do you have any shade? I can also see that she has no edema, which is good. Okay, I'm gonna lay you flat. Have you had any nausea or vomiting lately? No. Okay, I'm just gonna lift you.
Inspect and palpate your head, neck, and sinuses real fast. I'm just gonna look through your hair. Good.
Nails and your toes. Here I'm inspecting for color, contour, shape. Same with your toes. Good. And then I'm palpating for capillary refill, which is less than 3. And then I'm also palpating for texture. Good. Alright, that's good. And that's all for the skin. Then after the skin, we're going to move on to the head. So I'm just going to check your facial features. So I'm going to have you smile. Good, no drooping, and symmetrical. And then I'm going to between the pubic symphysis and the anterior superior iliac spine. And then I have popliteal. And then I have, if you can flex your legs back, or feet back, dorsalis pedis. Then I'm going to go here, and I have the posterior tibialis. Okay. So I'm going to have you sit back up for me.